If your knees feel stiff and achy because of arthritis, this might be the most helpful video you watch today. Because in just 30 seconds, I'm going to show you a powerful way to ease that pain right from the comfort of your home. If you are struggling with knee arthritis, especially when standing, walking, or getting out of bed, then you are not alone. In this video, you will learn a series of simple movements designed to reduce stiffness fast by gently activating and stretching the muscles around your knee joint. Some of these can work almost instantly, but to get the most lasting results, make sure to try each one and notice which gives you the most relief. Ready to feel the difference? Let us get started. Exercise 1. Seated knee extensions. Begin by sitting comfortably at the edge of a bed or in a sturdy chair. Make sure both feet are flat on the floor and your back is upright. Do not lean backward during this exercise. Now slowly straighten one leg out in front of you, extending the knee as much as you comfortably can. Try to keep your thigh in contact with the chair and your posture tall. Hold the extended position for a second or two, then gently lower your foot back to the ground. You can repeat this several times on the same leg or alternate between both legs. This movement might seem simple, but it is extremely effective at activating the quadriceps, the muscle at the front of your thigh that helps stabilize and support the knee. Remember to keep every repetition slow and controlled. Avoid any bouncing or quick movements. This is a great foundational exercise to start restoring strength and mobility in your knees. Exercise 2. Seated knee bends and extensions. Find a high chair or a sturdy table where your feet can hang freely without touching the floor. Sit near the edge so your knees are not blocked by the surface. Let one leg dangle down. From here, slowly bend your knee, bringing your foot backward as far as it feels comfortable. Then relax and return to the starting position. Keep the motion slow and steady. Avoid swinging the leg too quickly. You can also do the opposite by gently straightening your leg forward, extending through the knee. This simple back and forth motion is especially helpful if your knee feels stiff or tight. It encourages better range of motion and helps loosen the joint. If you do not have a high chair, sitting on a firm, flat table works just as well. The key is to let your leg move freely without hitting the floor. Exercise 3. Towel press for knee extension. Lie down on your back or sit comfortably on a bed or firm surface. Place a rolled-up towel underneath the back of your knee so that your leg is slightly bent. Now gently press the back of your knee down into the towel by straightening your leg. Focus on tightening the muscles at the front of your thigh, your quadriceps, as you press. Hold the pressure for a few seconds, then slowly relax. This exercise is especially helpful if your knee feels stiff or has trouble fully straightening. It also works to strengthen the quadriceps, which play a key role in supporting the knee joint. Repeat the movement several times, keeping it slow, controlled, and pain-free. Exercise 4. Lying heel slides with core control. Lie on your back on a bed, mat, or any firm surface where you feel comfortable. Keep both legs extended and your arms resting at your sides. Start by taking a gentle breath in and lightly tightening your belly, as if you are bracing for a gentle tap to your stomach. This helps protect your lower back while you move. Now slowly slide one heel toward your body, bending your knee as far as feels comfortable. If possible, try to bring it close to a 90-degree bend, but only go as far as feels right for you. Then slide your foot back out to a straight position. Switch sides and repeat with the other leg. Each time you bring both heels in, one after the other, that counts as one full repetition. Aim for 3 sets of 10 to 15 reps, resting in between if needed. Breathe naturally throughout and take your time. If your knee feels stiff or sore, stay within a range that feels good but still slightly challenging. Over time, this movement can help improve knee flexibility, activate your thigh and core muscles, and make everyday movements feel easier. Exercise 5. Muscle scraping with a spoon, a natural way to ease knee pain and stiffness. If you have been struggling with knee pain or stiffness, especially from arthritis, there is a lesser-known technique that may offer real relief. It is called muscle scraping, or gua sha, and it can be done using something as simple as a metal spoon and a little lotion or oil. This method comes from traditional healing practices and has recently gained attention in physical therapy and rehabilitation for its ability to improve circulation, reduce inflammation, and relax tight muscles and connective tissue. By gently gliding the spoon over the soft tissues around the knee, such as the thigh, calf, and sides of the joint, many people report a reduction in pain and improved mobility. It is believed to help break up fascial restrictions, stimulate blood flow, and support tissue recovery. For people with chronic stiffness, tightness behind the knee, or a locked feeling when bending or straightening the leg, this can be a gentle way to improve function without aggressive exercise. However, because this technique involves specific movements, pressure control, and knowledge of sensitive areas around the knee, we will not demonstrate the full method in this video. Instead, we will cover it in detail in a dedicated video, where we will walk through exactly how to prepare your skin, how to use the tool properly, where to avoid, and how to adjust based on your own sensitivity. If you are looking for a natural, non-invasive option to help with long-term knee discomfort, muscle scraping is worth learning about, especially when used as part of a gentle home routine. Stay tuned, we will guide you step by step in the next video. Exercise 6, bridge exercise. Strengthen your hips and support your knees. Let us begin by lying down comfortably on your back. Bend both knees and place your feet flat on the ground, about hip width apart. Your knees should form an angle of roughly 45 degrees. Keep your arms resting by your sides. Now gently tighten your stomach muscles. Then press your heels into the floor and slowly lift your hips up toward the ceiling. Imagine forming a straight line from your knees to your shoulders. Hold this position for 3 to 5 seconds. Then lower your hips back down with control. Rush. Once your hips touch the ground, take a breath, tighten your core again and repeat. Try to complete 10 to 12 repetitions. Take breaks when needed and repeat for up to 3 sets. Make sure your hips stay level. Do not let one side drop lower than the other. If this feels too hard, extend your arms out to the sides. That will give you more balance. If you want more of a challenge, cross your arms over your chest. This exercise builds strength in your glutes, lower back, and core, all essential muscles that take pressure off your knees during daily movement. Keeping these muscles strong helps protect your knees when you walk, climb stairs, or get up from a chair. Exercise 7, standing calf stretch. This stretch is great for relieving tightness in the back of your lower leg, especially if you experience stiffness around the calves, ankles, or knees. It can improve flexibility and make walking or standing more comfortable. To begin, stand facing a wall or closed door. Place both hands on the wall for support. Now, take one step back with the leg you want to stretch. Keep that back leg completely straight and make sure your heel stays pressed down against the floor. The front leg should be slightly bent with your knee pointing forward. It is very important that both feet remain pointing straight ahead. Do not let them turn out to the sides. Once in position, gently lean forward into the wall. You should feel a stretch in the calf of your back leg. Hold this stretch for about 20 to 30 seconds. Do not bounce or move abruptly. Keep it smooth and steady. If you notice the stretch fading, simply lean a bit more into the wall until you feel the tension again. After holding the stretch, return to the starting position and switch sides if needed. Repeat this stretch 2 to 3 times on each leg, or follow the frequency recommended by your physical therapist. If you made it this far, well done. Even just a few minutes of gentle movement each day can make a big difference when it comes to easing knee arthritis pain and staying independent as you age. Try to make these exercises part of your daily routine. And remember, do not rush, do not push through pain. Just listen to your body and move at your own pace. If one of these exercises helped you more than the others, I would love to hear about it. Leave a comment below and let us know what worked best for you. Your experience could help someone else too. And if you found this video helpful, please give it a like so more people can see it. You can also subscribe for more simple tips to stay strong, mobile, and pain-free, especially after 50. Thank you so much for watching. Stay well, and I will see you in the next video.